So, gentlemen, please invite Dr. Rao. Please welcome him. Sit erect and wait for orgasm. Thank you.
Good morning. I'm really happy that what Dr. Narayan Reddy spoke a few minutes earlier, that sex means it is not just giving medicine or some injection. Participative, recreative aspects are extremely important, and somehow such a vital aspect gets neglected in our clinical practice. Before I went into the topic, there was something I just clicked and all the things went off in my introductory slide. It only shows that sex also can be getting into trouble by just a very small touchy issue. I also want to tell you that a new journal called Journal of Psychosexuality is being launched with SAGE as publisher and WPA Sexuality section as one of the sponsors. We welcome you all for participation as one of the administrators, plus maybe the contribution to the journal in whatever capacity possible. Coming to the sexuality, we all have progressed and our life has become pretty mechanical, and we are all well aware, whether in office or at home, the problem is actually we are not able to manage a lot of things properly for the simple reason that we don't have time. And when I went to Rome some time back, there was a temple where Michelangelo has written how God breathed life into the Adame by just blowing air into his nostril. That's what actually what the literature talks about. But when you go into the details, it's actually the God touching the finger of this human Adam, which actually adds life. That means something which is very vital we have forgotten, and we are talking so many things actually differently. Historically speaking, from as a psychiatrist point of view, Mesmer, at one particular time he told about mesmerism, what we call the laying on hands, and all of us carry certain types of magnetism, and that can be transmitted, recognized, and various therapies have come, maybe alternative, complementary, and such other terminologies one may be trying to use. And then touch as something extremely important in therapy, and from that particular angle, if you try to look at for that the communication, this is one of the very vital component. And I practice in Mysore and Bangalore. These are the two places where this IT-BT and plenty of people, very educated, earning 5-digit salary, but land up with what we basically call divorce in no time, 3 months, 6 months, 1 year, for the simple reason that they believe that the partner will respond by just like computer, I press some buttons and she will respond. That's what actually which leads to quite a bit of difficulties. And as we actually recognize, these gadgets have added a different dimension to our life, that they are actually keeping us much apart than actually bringing us together. There was another very early study, what we call as hospitalism, wherein the children not thriving, they were trying to do a lot of experiments actually why this particular thing is happening with taking care of so many things. And then there is something like the founding hospitals, that children dying significantly, and there was a German lady in one of the German hospital where the children were surviving without much difficulty. A comparison was made, and what they found was that there was an elderly lady who used to hug the kids, and that was actually which was actually adding to the survival. The child not being touched, given that particular comfort, is not likely to survive. And this is the whole concept that has come into what we call the healthy baby, or maybe the good children upbringing, what we were talking about, Indian Association of Pediatrics, talking about the cribs should not be there in the hospital at all like that. Immediately after the delivery, within 1 hour, the child should be breastfed. Majority of these type of concepts have come subsequent to this particular idea. There is another study by Harlow which talks about isolated monkeys, 2 types of surrogate mothers, one with mesh wire which actually provides milk, but another with what you call as the woolen clothing. Actually this baby tries to hug this wooden clothing, the cloth covered surrogate mother, rather than the mesh wire which actually provides milk, emphasizing the point that somehow this particular point, that touch, is extremely important. It is there all around us, but somehow it gets neglected in our clinical practice. That's what actually the whole purpose of this presentation, to bring back that this is one of the extremely important idea. Among all the senses what you have, this is one of the most important. Sight, hearing, taste, smell, in fact, they all there, but one can survive, but not without touch. I'll come to that point 1 or 2 minutes later. The smell first to leave while falling asleep and return when lost actually. And this is one of the reasons many people don't recognize that in a building or somewhere actually the fire has come up, what actually is happening. And men are born with what we basically call handicap. What is being said is that hearing acuity is about 25 to 30% less in case of men compared to women. This is one of the reasons why actually the wife tells 10 points means only remember 1 or 2 points, and we get scolded actually in the end of the day for the simple reason that we are not acuity wise well versed with what we basically call what the women have the capacity. If women can understand this means actually men can have much better life. This is one of the points. The skin, when we are trying to talk about touch, is one of the very important organ, and it is covering our body, a miraculous envelope, and actually how much it is and all, like in fact the data is available. But what is being said is that the value of this is actually not recognized for various reasons. Unfortunately, this is there actually in our historically looking into in very many things that touch is extremely important and should be taken care of. This is what actually the Marston Johnsons and a lot of other people emphasize, and that is actually being carried forward. The current medical practice somehow relies on what you call as the mechanical methods, which actually can lead to quite a bit of difficulty. At birth, all sensation and information is through the skin for the baby. Baby's snuggled body actually picks up the heartbeat of the mother, drinking milk from the bottle, and lot many other things, in fact, which helps actually the child to be comfortable with the mother rather than with anybody else, for the simple reason that that rhythm it actually matches. Current society does not encourage touch. In fact, we have a lot of difficulty. And let me tell you, about 3 months ago, there was an American Psychiatric Association conducting a program in Hyderabad. They were talking about Lurasidone, a newer molecule. 3 days program. At the end of the 3rd day, I had to just stand up and ask, does it have any sexual effects or sexual problems? They were telling, in fact, in America, to talk about sex is actually something prohibited. You talk about it means people misinterpret. And this is one of the reasons why even in doing studies, they don't nowadays talk about. See, this is one of the land where it is actually so open and all we talk about, and it has gone to one full circle where now they feel hesitant to ask this question and get into the details. So, don't be touchy. Touch as a social leveler, and many other such aspects are there one can actually look into. Fortunately, it stimulates a whole lot of chemicals in our body, and absence or lack of it can create quite a bit of difficulty. I won't go into the details unless some questions come a little later. The loss can be terrifying. Psychotic breakdowns have been reported in absence of it. Study on boredom at McGill University talks about the loss of touch sensation can create whole range of difficulties and psychological problems, starting from mild to severe form of degree of difficulties. Touch hunger, Desmond Morris talks about it. What he talks about is that this is actually a necessity. Just like what we need water, food and air, this touch strokes are extremely important, absence of which can create quite a bit of difficulty. And nowadays we talk about husband being there, but he's totally preoccupied with the laptop, even in the bedroom. In fact, she almost turns out to be something like a widow, because this fellow is there, but it is almost not there for any of the purposes. So, these are few of the difficulties what people have spoken about. Little later I am going to talk about many of the people who present to us with multiple somatic complaints, aches, pains, burning sensations, and they don't have any specific cause to explain, and many investigations and such other things they want to undergo. All of these things indicate that this particular lady is not serviced properly. What this service means, actually what I am trying to talk about is actually not necessarily the sexual intercourse, but that not spoken to, touched, hugged, and many other such actually absolute necessity for a person. So laying on hands is actually gaining renewed importance, what Mesmer spoke long ago. Touch has the most tangible of senses, but varying attributes make it mystical, because for each one it is quite different. Each of the religions talks about touch as extremely important. Even in fact, you look into Jesus' 14 miracles, all of them are related to actually the touch phenomenon only. Buddhist shrines, Islamic mosque, Taoist temple, or Hindu traditions, all of them talk about extreme importance of the touch. Touch for health and for healing is not ignored, but unfortunately currently this is somehow not getting the importance what it is actually supposed to get. Many of these complementary or augmentative and lot many other therapies we talk about, all are based on what we basically call the touch related. Again, keeping in mind the time constraint, I won't go into the details. And fingers, most effective sex organs. What actually being said is that women have what we basically call frigidity and such other things what we used to speak earlier. And now that there is that particular word we should not even use at all like that. That so-called frigidity is actually pre-orgasmic state, what is being said. But if we can add the type of stimuli, in fact, the woman can be taken to orgasm. Ultimately, use of vibrator, almost 100% of the women can be taken to orgasm, is actually some of the studies what they have reported. That way, a man is really fortunate. He is actually having 11 vibrators, one in the center, and each of the fingers can be used as vibrators. So, recognizing it is actually what is actually important aspect. We emphasize, unfortunately, the importance of what we basically call the sex organs, the size of the penis, the extent of hardness, and such other things. And both men and women are totally concerned with this particular aspect. Many believe that sex means it is actually that nut-bolt phenomenon, purely mechanical, something you put it and that is end of the story. Whether young or old, this idea that having erection is one of the most important indicator of our life. But unfortunately, when you try to talk to particularly the ladies, one of the point raises actually a girl does not look for six packs in men. What they actually trying to look for is actually something totally different, and those aspects are related to touch and such other related phenomena. We'll come to 1 or 2 minutes later. Time Newsweek carried quite a bit of articles on this, and somehow the sildenafil citrate works in case of man. It doesn't work in case of females. Why actually? In fact, the same physiology, same structural influence, but unfortunately, it works in one individual, but it doesn't work in another individual. So we need to again look into what actually we are trying to do, and we have heard some of the lectures wherein doing censored focus, this, that, and lot many other things are spoken in very casual manner. In fact, it is a process that need to be undertaken in a proper way. Otherwise, what precisely happens is actually just giving an advice, this particular thing people have tried, partner has tried, and it has not worked, and you are just one single advice that spend little more time or this, that, and that type of very casual remarks not likely to benefit the individual. This is the advertisement of a century bed wherein it talks about you sleep on the bed, all the problems get solved. But unfortunately, if you try to look at sleep hygiene, they also speak, you don't do any other activity other than sleeping on your bed. Some of the pages, they present this type of statements in their presentation. So sex for that, where they have to go, whether they have to come out in the hall and finish and then go back to the bed. And other aspect what we have seen is actually happily married. We have one Malayali teacher in our department. He is extremely happy after marriage what we are seeing, because he is here and his wife is somewhere else. Now you got the point? There are no difficulty with this fellow. And what actually Woody Allen mentioned, that love is the answer, but while you are waiting for the answers, sex raises some pretty good questions. And this presentation, we are not talking about purely the physical aspects of it, but it is actually something more than that. So this participative and recreational aspect of sex is extremely important. Or even if you take a definition of sexuality, that should encompass all these aspects as part and parcel of it. This is what actually the whole emphasis here. Whatever actually we are trying to talk about as purely physical activity is not likely to eat. So sex as a conversation carried out by another means is actually one of the very important aspect. The relationships matter. Intimacy, sensuality, sex and sexuality. And when you are trying to talk about intimacy, there are a range of issues. Keeping in mind there is already time is running out, let me just run a little faster. That means there are a lot of things. That means the partner believing in the spouse is actually extremely important. Many of the times there may be issues which are actually unconscious. So what we see on the surface may not be that much juicy. What we don't see are much more important component. So intimacy really matters, and when you are trying to talk about intimacy, the sexuality is one of the, touch is actually one of the extremely important component. And when we are trying to talk about sensuality, this is somehow we have missed. What it means is there are plenty of activities, starting from taking bath, noticing breeze on the face, having massage, listening to music, lighting candles. Each of these things are extremely important component, and these are all very, very important. I still remember I was doing PG, and one of the other person was teasing one of this lady PG. See, your husband while coming, he was looking at all the girls. Her prompt answer was, more hungry, that much better. Now you got the point? See the very sportive way of looking at it. I still remember another patient which I was treating. Husband was telling, sir, she doesn't wear clothes properly, doesn't take bath every day. When we brought this particular issue to the wife, her comment was, sir, please tell him I am married, not his girlfriend. Now you got the point? Because I am married, I don't have to bother at all about my personal hygiene, and lot many other things are very important components which actually can create quite a bit of difficulty. We are all well aware men are fast and women are slow because of so many reasons. And one of the important thing is man can get aroused very fast. This is our Kejriwal. This particular photo I have focused mainly because look at down, he is having erection. Can you see that? Very interesting. So many people around, but man can be ready. You got the point? But woman, this doesn't happen. So for that, there are a lot of things are necessary. And you lit the fire and don't take it off is actually one of the very common component. And not going to, except to emphasize the point that women take little longer time. And currently, the David Reed's concepts of what we were starting from seduction, sensation, surrender, reflection, other things, they are all indicators of a lot of psychological and such as components are extremely important. It takes time, but they can be multi-orgasm is actually what Marston Johnson mentioned. And when you try to look at brain and different parts, in case of male, all those things which are well developed are those which actually relate to the motor activity or certain physical activity. All that cognitive or emotional, empathy, many other things, they are all very poorly developed in case of male brain. And in case of female brain, they are so well developed. This is one of the reasons why it can create quite a bit of difficulty, and from touch point of view, extremely important. And let me not go too further into that, except that the arousal when we are trying to talk about woman, it is for many different erogenous zones. In case of man, all of them are concentrated in one particular place. This is one of the things which actually leads to quite a bit of difficulty, and why in sex therapy, adding this touch component is actually extremely important. And what we talk about intensive therapy is nothing more than that. So Marston Johnson spoke about this, and it takes a little bit of time. What it means is actually the touch is one of the extremely important component, and it has having three areas. One is communication and relationship, second one is self-awareness, and third one is actually mutual sexual interpersonal related issue. To run it fast, without communications we are nothing, and this is extremely important. Many women believe that why I should prepare coffee, but it may be very interesting that prepare coffee, go and sit. In fact, what you need is available or possible. Husband has towel when in the bathroom, why I should give it? No, you got the point? You can go to the bathroom with the towel, and in fact there can be a session. You got it? So it can be wonderfully planned in individual's life. He should talk or he should talk. Rather than that, in fact, you start off. Go to the kitchen, cut some vegetables, walk to the bedroom, she will follow like a lamp. In fact, many time people talk about is one of the extremely important components. This is one of the key slide of my presentation. What it means is, when we are trying to talk about women's sexuality, with fantasy alone, many women don't get aroused. Again, men can fantasize, but women cannot. When we went into the details, see, for a woman to fantasize, you ask her to fantasize, what she will do is actually imagining husband with the pant, with the lungi, with the towel. Got the point? You can't get aroused. Man can close his eyes and think of about 1,000 women actually without much difficulty. So, fantasy doesn't work with women. Again, sexual intercourse, only about 30% of the women can reach orgasm. And what we basically could talk about, the touch, and when we are trying to talk about inhibited sexual orgasm or inhibited sexuality in case of female, it is the touch and touch alone. Training the woman in masturbation, and is actually one of the only important component. Many of them don't know, not aware of, many of the sensations associated with that. That they are being aware means actually they can train the partner. So many of those issues are there, and what we basically call with vibrator, in fact 100% of the women can be taken to orgasm like that. Many women getting into the divorce and such other things subsequently after many years of married life is actually related to again the development of what we call this missing something related to what we call touch. Self-awareness, physical, training the woman in masturbation, actually becomes, and we did a study on actually about 500 women, only about 32% women reported masturbation sometime, and about 12% were reasonably comfortable. What it means is, what actually they should be aware of, hardly they are capable of knowing. So how actually one can go about, there are multiple ways actually one can look into. So taking bath to, in fact, touching, understanding one's actually the sexuality. The second particular component what we are trying to talk about is actually the sensate focus. The principles here is actually that touch and touch alone is sufficient activity in case of what we basically call sexual programming. The physical activity like intercourse and other things actually comes as one part of it. That's over actually. So 3 stages: non-genital, genital, and actually what called the response. How one can go about. In fact, these are all part and parcel of our training. And if somebody is interested, I'll just focus one video which is there, very interesting about man and woman. Carry home message. Chairman is asking me to stop. There is a reason. Yeah. That harassment and lot many things we talk about is actually touch related. Flibanserin may not be successful, may be successful because again lot of other things you need to add. What we basically call when a carry home message is actually both partners should be actively participate. Partner is busy with something else means actually it's not going to work. Aphrodisiac is actually the partner, and the fantasy is actually one of the best aphrodisiac known. Communication. Cure is the cuddle, not anything else actually is one of the most important emphasis. Men need very simple things, but women need lot of things.
मैम ये लड़कियों का प्लेजर पॉइंट कहाँ पड़ेगा?
जीसपा जाने का है ना, मैं बता दूँ। यहाँ से बिल्कुल सीधा जाए, इधर ही है। सीधा आएगा अपना वजीना नगर पे टोल आएगा। उधर ऐसे अपना पर्सनालिटी कंसेंट विंसेंट डेट वेट लेने का। उसके बाद आएगा छोटा लाबिया गेट। वहाँ पे बहुत संभाल के चलाने का है, बहुत स्लिपरी है। फिर फैलोपियन फ्लाईओवर अगर आगे ना तो तू बहुत आगे निकल गया है। तो वहीं पे गाड़ी घुमा के थोड़ा ऊपर नीचे आगे पीछे that's the spot right there keep it going, yes oh yes मतलब फिर बारिश हो गई तो समझ के पहुंच गया।
तो वजीना नगर से स्ट्रेट।
बस ये लड़कों का प्लेजर पॉइंट कहाँ पड़ेगा?
मैडम यहाँ से सीधा जाने का एक बिल्डिंग पड़ेगा, एक ही बिल्डिंग है, बुर्ज खलीफा टाइप।
बिल्डिंग से कहाँ?
कहीं नहीं, उधर ही आसपास कहीं भी, कुछ करने का भी नहीं, सिर्फ सोचो, फुल घनाघन।
बिल्डिंग। Yay! Thank you.
I know.
Okay.
This is what actually the whole difference, and don't forget touch in therapy. There are a lot of books published from our side. If somebody can write to us, means we can transmit some of these what we basically call the digital copies. With this, there is what we call as clinical practice guidelines in the management of sexual dysfunctions, published by IPS, available. Anybody can visit this indianjpsychiatry.org website, available there. Thank you very much.